So now that we have gotten an overview of what knee osteoarthritis actually is, we'll move on now to talk about what we usually do in a physiotherapy session for knee osteoarthritis. And I think a good first step would involve patient education, where we help them to understand what knee osteoarthritis actually is, how to manage the condition over the longer term. Because we understand that knee osteoarthritis is a chronic condition, and therefore it is important for them to know how to manage acute flare-ups of knee osteoarthritis. Activity modification would be for patients who regularly engage in high-impact exercises, so things like running, basketball. Perhaps they could be doing it at a very high frequency and the knee is getting increasingly sensitive. We may advise them to engage in lower impact activities like cycling or swimming, as these are generally less stressful for the knee joint and should help with knee sensitivity. Likewise, for your overweight or obese individuals, we often would discuss the role of weight loss, as obviously with increased weight on the knee joint, and if the knee joint is already sensitive because of osteoarthritis, then that extra weight is just going to create more sensitivity in the knee joint. Therefore, for these group of patients, weight loss would be an extremely important component of their management plan. Lastly, we would want to promote an active and healthy lifestyle for knee osteoarthritis sufferers, as your cartilage needs a certain amount of load each day in order for it to remain healthy. So, in knees that are extremely sensitive, you may find that if you engage in too much activity, it makes it extremely sensitive. But if you do not engage in activity at all, your knee cartilage is going to become extremely unhealthy and your osteoarthritis may actually deteriorate further. Now that we've looked at patient education, the next first-line management that we usually do for knee osteoarthritis would be exercise therapy. And there is a good body of research to show that by strengthening the hip muscles and knee muscles, it can help with improving knee function and pain. Some complementary modalities that we use to complement exercise therapy would be things like manual therapy, where we look at mobilizing maybe a stiff joint. And often we find that in these osteoarthritis patients, occasionally their hamstrings or calves can start to become tight. And these patients may benefit from soft tissue release of these muscles. The other modality that we often like to use is neuromuscular electrical stimulation, or TENS. And the neuromuscular electrical stimulation helps to improve quad strength, while the TENS machine is generally more helpful for providing pain relief. So in all, overall, for physiotherapy management of knee osteoarthritis, often what we look at is patient education, exercise therapy, and a combination of perhaps manual therapy and neuromuscular electrical stimulation, or TENS. I hope you found the information in this video helpful, and I hope it gave you an overview of what we usually do for knee osteoarthritis sufferers. Thank you, and see you next time.